The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. We will get started in just a couple minutes. We'll give everyone another minute or two to get logged on. Okay, good afternoon, everyone, and thank you for joining us. Welcome to the Molly Fund webinar featuring Dr. Thomas and his talk on the lupus secrets. So I just want to go over a couple things before we get started. All attendees are in listen-only mode, so if you do have a question, feel free to type it into the chat box on your screen. You can ask questions at any time throughout the presentation, and we will answer all questions at the end of the talk. So go ahead and type in the box when you think of anything. And if you have any additional questions or need help answering any technical issues, please feel free to email us at info@mollysfund.org. I also just want to remind everyone that everything that is discussed here is some great information from Dr. Thomas, but always make sure to consult your doctor anytime you are switching your treatment or any changes in your medication. So I just want everyone to remember that. I am also going to have a poll starting, so if everyone can take a second to just answer so we can get an idea of who is joining us today, whether you're a patient, a caregiver, or anyone else in the lupus community. Okay, so just a little bit about Molly's Fund. My name is Tracy Stone, and I am the program manager at Molly's Fund Fighting Lupus. We are a nonprofit-based organization in Portland, Oregon, and we offer a number of programs and services for lupus patients and their families. Some of these services include in-person and online support groups, a referral and resource network, and many local and virtual events that you can participate in. So for more information on any of these, feel free to email us or visit www.mollysfund.org. So now a quick introduction for Dr. Thomas, our keynote speaker here. Dr. Donald Thomas is a rheumatologist with a special interest in lupus. He is in private practice with Arthritis and Pain Associates in Greenbelt and Clinton, Maryland. He has been an active member of the Medical Scientific Advisory Council for the D.C., Maryland, Virginia chapter, previously the Greater Washington chapter of the Lupus Foundation of America since 1999, and currently serves as its chair. In addition to his love of taking care of patients, he also loves teaching other physicians about rheumatology issues as an assistant professor of medicine at the Uniformed Services University of the Health Sciences in Bethesda, Maryland. He is a strong advocate for people who have lupus and is the author of the upcoming book from Johns Hopkins University Press entitled The Lupus Encyclopedia, a comprehensive guide for patients and families. This book is not yet released, but will be available within the next couple weeks. And Dr. Thomas also recently came out to Oregon to give this similar speech to our local group over here. So it was really great to meet him, and I am excited to share his talk with the rest of you. So with that, I am going to pass it over to Dr. Thomas.
Thank you, Tracy. Can you hear me?
Yes.
Okay.
You should have control of the screen in just a second. Okay, you should be able to pull up your slides.
Okay, mine's up. Is it visible to everyone?
Not yet. Let's give it 1 second. Okay, there we go. Go ahead.
Okay. Well, thank you very much, Tracy. My name's Donald Thomas, as Tracy mentioned, and I'll be talking for the next 45 minutes to an hour about what I call the lupus secrets. So a few months ago, I was talking and working with Carrie at Molly's Fund on an article on the internet about a lupus topic, and she asked me if I would be interested in coming out to Portland, Oregon, to Molly's Fund to give a talk for lupus, and of course I said yes. And so the first thing I did is I did a Google search for Portland, Oregon, and this is what I found. Made me a little nervous about going to Portland, Oregon. It's like, what was I going to say when I saw these people, and how would I react, and how was I going to not look shocked, and what if they had some food stuck in their teeth? Well, then I did some more Google searching on the internet about Portland, Oregon, and I found this cool documentary about Portland, so I ordered it from Netflix, watched a few episodes, and figured they were just funny, quirky people and probably very easy to get along with. Then on Friday, this past Friday, I took an airplane trip from Dulles Airport from Washington, D.C. to Portland, Oregon, a 5.5-hour flight, landed late at night. The next day, I got to meet the people of Portland, Oregon and Molly's Fund. And you know what? They were just like the people back home, very nice, friendly, and welcoming, and we really had a wonderful day advocating for systemic lupus. For those who don't know, this past Sunday, or this past Saturday, was World Lupus Day, where lupus advocacy was celebrated throughout the world, and we were very happy to partake in that. The lupus secrets, I call this the lupus secrets not because they're really secrets, but because most people with lupus don't know about these important things that they should do when they have systemic lupus. And so since most people don't know about them, they just appear like they're secrets. Anyone who has systemic lupus knows that it is a devastating disease that can attack any part of the body. People get the disease by inheriting genes from both their mother and from their father, but it requires things in the environment to turn the disease on and trigger it on, and that it can even make the disease more active. However, even though lupus can make the person with lupus feel powerless and not under control. The good news is that a lot of these triggers can be avoided, and that there are a lot of things that people can do to take better control of lupus instead of lupus controlling the person. And that's really what my goal is during the next 45 minutes, is to share some of this important information with you as the listener so that you can know the right things to do when you have systemic lupus. In addition, I do have a handout for this talk as well, and we will be sharing that with you in an email from Molly's Fund. So there's going to be even a lot more information in this handout than what I'm giving in the slides here. So secret number one, you should never take sulfa antibiotics. Sulfa antibiotics such as Septra and Bactrim, they can actually cause lupus flares. Not only should you remember this, but you should actually write it down as an allergy. In fact, I urge all patients with lupus to always carry around something with them in their purse or their billfold that has, number one, a list of their allergies, number two, an updated list of their medications, and number three, a list of their current medical problems, including what problems lupus gives them. The reason for this is that every single year I have at least 1 or 2 lupus patients come back with a severe flare of their lupus because they went to the emergency room very sick with a urinary tract infection, which caused them to have high fevers, shaking chills, and they were so sick they forgot to tell the doctors that they shouldn't take Septra. They were given Septra for the urinary tract infection and then had a severe flare of their lupus. So write it down as an actual allergy for sulfa antibiotics and never take them, and let all doctors know this. Secret number 2, keep a personal home record of your medical records. Don't rely upon the doctors to share information. Although I share everything with my primary care physicians every time I see a patient, that doesn't happen everywhere. And it's really important that you be able to show laboratory results and notes and x-ray results and biopsy results to other doctors. And the most important part of this is especially keeping those notes from when you first were diagnosed with lupus. Have copies of the lab results, biopsy results, doctor's notes, especially those that established your diagnosis of lupus. A very important reason for this is that people move, insurances change, and unfortunately people have to oftentimes change rheumatologists. I have had a few patients of mine who actually traveled somewhere else or had to get a new doctor because of insurance and then failed to get copies of my records. They show up at the new rheumatologist's office. They're in great health. Their lupus is under excellent control, or what we call clinically quiescent, and then their blood tests are done, and lo and behold, their anti-nuclear antibody is negative. By the way, this happens 20% of the time in people with systemic lupus who are under good control. Their ANA actually becomes negative 20% of the time. So these patients were told they don't have lupus, their medicines were stopped, and unfortunately a couple of them had severe flares. One of these was a young lady who ended up having a severe stroke and could hardly talk afterwards. So do yourself a favor and keep all of your results, especially those that made your diagnosis, so that you can give these copies to other doctors if you need to. Secret number 3, heart attacks and strokes are the #1 cause of death in people who have systemic lupus. It's not only important to learn how to control your lupus, but it's important to learn how to prevent heart attacks and strokes. Numerous studies within the past 15 to 20 years have shown that our patients with lupus get heart attacks and strokes at a younger age than other people. In fact, with African American women, they occur 20 years younger than their peers. In most African American women, we expect to start seeing heart attacks and strokes on average in their 70s, but in lupus patients, it's in their 50s. In my own patients, I have patients who have had heart attacks or strokes in their 20s and 30s. Finally, in 2011, the American Heart Association came up with this update. They said, women with systemic lupus without clinically relevant heart disease should be considered at risk for heart disease and screened for heart disease. In other words, in layman's terms, they actually put lupus right up there with high cholesterol, high blood pressure, cigarette smoking as far as risk factors for having heart disease. They even took one step further. They said women who have heart disease should be screened for lupus and allow for the autoimmune disease condition to be addressed. So they even said that women, especially if they're young women, if they have heart attacks or strokes, should actually get an anti-nuclear test and see if they might have systemic lupus or related systemic autoimmune diseases. So the end of secret number 3 is do everything you can to prevent heart attacks and strokes, including taking aspirin 81 milligrams a day, especially if you have any other risk factors for heart disease, to include high blood pressure, high cholesterol, diabetes, strong family history of heart attacks, and especially if you're positive for antiphospholipid antibodies. That's always a mouthful to say, but 30% to 50% of all systemic lupus patients are positive for these particular antibodies. These antibodies, when they're present, can actually cause blood clots that can cause heart attacks and strokes. If you take a baby aspirin every day, or 81 milligrams, it can help prevent this. If you're not sure if you're positive for these antibodies, just ask your rheumatologist, because all of us check them in all of our systemic lupus patients. Do you feel down in the dumps? Do you have problems with memory and concentration, severe fatigue, trouble sleeping, headaches? Do you hurt all over? If you do, most of the time these particular problems are usually not due to the systemic lupus itself. By far the most common causes of these problems are fibromyalgia, depression, and anxiety disorder. All the prednisone, methotrexate, Plaquenil in the world won't help these particular symptoms, and we have to use different types of treatments that are targeted towards fibromyalgia and depression. By the way, all 3 of these disorders are neurochemical imbalance disorders. There's too many pain messages being sent to the brain by pain messages. There's a lack of serotonin and norepinephrine in the brain, and these disorders have to be treated with exercise and medications which reverse these chemical imbalance disorders. If you have those symptoms I just mentioned, I would urge that you take the self-test in the handout that we'll be giving you. You can actually do these tests at home to see if you might have fibromyalgia or depression. And if you score high on these tests, I urge you to take these test results to your rheumatologist or primary care physician and ask them if these diagnoses might be a cause of the symptoms you're having and have them addressed. In fact, depression is especially important. Recent studies show that depression is underdiagnosed and undertreated in our patients who have systemic lupus. I look at mouths all day long, and there's a very good reason for that. This particular tongue shows the classic signs of a dry tongue with a deep furrowing, and it's not nearly as moist as it should be. 30 to 50% of people who have systemic lupus will have a complication called Sjogren's syndrome. It's spelled with an SJ, but we pronounce it like an SH, Sjogren's syndrome. This is an autoimmune disorder where the lupus attacks the glands of the body, and the glands stop making fluids, and it causes dryness of the mouth, dryness of the eyes, dry itchy skin, especially in the wintertime, and even dry vaginal area, which can be very painful with any type of sexual activity. Most people don't even bring this up to their physician because they don't realize the dryness is a medical problem. If you're positive for SSA and SSB antibodies, it's even more likely that you have this problem. SS stands for Sjogren's syndrome. The dry mouth is especially important to have acknowledged and treated because when you don't have enough saliva in the mouth, it can end up causing problems such as gingivitis, thrush, other infections in the mouth, and people with this complication oftentimes start to lose their teeth at a younger age, and it's very treatable. We're actually able to increase the moisture and prevent these complications from occurring in the first place. For more information, you can go to www.sjogrens.org, and that's the website for the Sjogren's Foundation. Secret number 6, keep your blood pressure under excellent control. Primarily because we want to prevent those heart attacks and strokes. So every time you see a doctor, ask the doctor what your blood pressure is. If it's above 140/90, then you should be asking for better blood pressure treatment. Oftentimes, blood pressure is not treated aggressively enough. In fact, if I was a lupus patient and mine was above that, I would want to see my primary care physician every few weeks until I got it under perfect control. If your blood pressure, or if you have protein in the urine, if you've had a heart attack or stroke, then we recommend even more strict control where the blood pressure is kept below 130/80. As far as cholesterol, we have both good cholesterol and bad cholesterol. On the left side of this cartoon shows the bad LDL, bad cholesterol. This is the cholesterol that actually clogs up the arteries. Then on the right we have a depiction of the good cholesterol called HDL. I'm sure that many of you have been told by your doctors that you have a lot of good HDL or good cholesterol and that you're at low risk for heart disease because that HDL cleans up the mess inside of the arteries. Unfortunately, lupus does not follow the rules. In 2006, Dr. Beverly Hahn, a famous lupus expert in California, she showed that 45% of her lupus patients had a bad type of HDL cholesterol called pro-inflammatory HDL. Most of the time, HDL should actually decrease inflammation and decrease heart attacks and strokes, but this particular type of HDL actually increased heart attacks and strokes in these lupus patients. At this point in time, unfortunately, we're not able to separate the good HDL from the pro-inflammatory bad HDL. So when your doctor does a lipid profile or a cholesterol panel and finds that you have a lot of HDL in your blood and tells you you're at low risk of heart disease, unfortunately with lupus, that's not true, because you don't know if it's good or bad HDL. And at this point, we can't separate it out. It's not clinically available yet for this particular test. Hopefully in the future it will be. And by the way, most doctors and even rheumatologists don't know this particular problem with HDL. So even if you bring it up to them, they may not understand what you're talking about. The bottom line is that you can't trust a high HDL protecting you from heart disease when you have systemic lupus. So what can you do about this? Fortunately, there is something you can do. In 2010, Dr. Hahn did some additional studies in her patients with systemic lupus looking at these HDL levels, and she found that those who exercise regularly had markedly lower amounts of pro-inflammatory HDL compared to her lupus patients who did not exercise, and that they also had less blocked arteries when she studied their arteries. So the bottom line is that you need to exercise regularly if you have systemic lupus erythematosus and you have a high HDL level to make sure that you get rid of any possible bad pro-inflammatory HDL. So secret number 7 is high HDL does not equal good cholesterol in systemic lupus. Secret number 8 is please don't smoke cigarettes. Of course, it's much easier said than done because nicotine is highly addictive. It's one of the most addictive substances that's legal for people to have without a prescription. There's several reasons why you should not smoke. Number 1, smoking actually keeps Plaquenil from working. There was a nice study that showed that patients with systemic lupus who smoked, it was much harder to control their skin disease with the lupus than those who did not when they were on Plaquenil. In addition, there's a chemical inside of smoking cigarettes that actually causes lupus to be more active, and the name of that substance is hydrazine. Hydrazine is a well-known trigger of lupus, and this hydrazine actually makes lupus more active. In addition, of course, smoking increases the risk of heart attacks and strokes, the #1 cause of death in lupus patients. Lung cancer occurs more commonly in lupus patients and is strongly associated with smoking cigarettes. And then it also weakens the bones and causes osteoporosis in our patients as well. There is some help available to stop smoking, and I would urge you to call this 1-800 number or go to smokefree.gov to try to learn to stop smoking cigarettes. Secret number 9, please exercise regularly for multiple reasons. The reason I'm showing these women dancing is for a very good reason. Memory loss is a common problem in people who have systemic lupus. And memory experts state that regular exercise is one of the most important things to do to increase memory and to decrease the onset of dementia. The exercising helps to increase blood supply and oxygen to the brain. But the reason dancing is the best exercise for memory loss is because when you dance, you're actually using a lot of different parts of your brain at the same time, or what they call cross-training the brain. You're using your brain to balance your body as you're moving. You're memorizing steps at the same time. Your ears are listening to music, and then you're timing your movements to the music as well. Dancing also increases mood, improves sleep, and just makes people feel a lot better. In fact, if people listening to this, if you watch the Dr. Oz show, he's actually had a memory expert on there named Dr. Fatuhi, and he highly recommended dancing as the exercise of choice. These are the things that exercise does for people who have systemic lupus. We know that from studies that people with lupus who exercise regularly have less heart attacks and strokes. It decreases that bad HDL cholesterol that causes inflammation. They're less apt to have excess weight. It improves sleep at night. Insomnia is a huge problem in lupus. It improves memory, which is also a big problem. In fact, what we call lupus fog or fibro fog is improved by exercising regularly. It improves sense of well-being. It actually decreases pain levels, decreases stress, and is one of the most important treatments for fibromyalgia and for depression. I actually put this cartoon up in every single exam room. Whenever I ask someone to start exercising, they always come back to me and say, "Oh, Dr. Thomas, I'm just too busy to exercise." And so this patient is saying that to the doctor on the left, and the doctor says, "So what fits in your busy schedule better, exercising 1 hour a day or being dead 24 hours a day?" And it's so true. It's very important that people start to prioritize things in their life. When you have systemic lupus especially, it's important to figure out what things are really important to you and which ones are not, and your health should be one of the most important things in life to do, and you need to learn to say no to all those unimportant things that we do every day. So what is the second most common cause of death in systemic lupus? And the reason I bring up these causes of death is that if you know what bad things can happen to you, then you can take it into your control and power to prevent them from happening in the first place. The second most common cause of death in lupus patients is actually infections. In fact, before there was any treatments whatsoever for lupus back in before 1949 when prednisone came around, the most common cause of death in lupus patients, even before medicines, was actually infections. And so it's really important to prevent infections from happening in the first place and have them treated. So secret number 10 is if you ever have a fever, you never want to automatically blame it on lupus. Always make sure that you don't have an infection first. So we urge our patients that if they have a fever, to call up and see their primary care physician immediately. Or if it's a weekend or an evening, just go right to an urgent care center or your closest emergency room. Get an evaluation by a doctor, because if it's an infection, it needs to be treated right away. Secret number 11 goes along with the infection category, is get the flu shot yearly. People don't realize how bad the flu is, but it's incredibly important to prevent. 20,000 to 50,000 Americans die every single flu season simply from complications of the flu. The vast majority of these people who die are the very young, the very old, or those who have compromised immune systems such as systemic lupus. In addition, those who die usually did not get the flu shot, and most of them never had the flu before. And so it's really important you get that flu shot every single fall. It's such an important thing to do. I've had influenza twice myself in my life, and I will never get it again. I religiously get that flu shot because it is miserable. Secret number 12, if you're on an immunosuppressant medication, please get 2 pneumonia shots. And this is a big secret. Even most doctors don't know this, and so this is something you might even have to tell your own physician to order for you. There's 2 different pneumonia shots. There's the Pneumovax, which most doctors do know about, but there's a new recommendation called getting the Prevnar pneumonia shot that you should also get. This is a list of the immunosuppressant medicines. If you're on prednisone more than 7 milligrams a day, methotrexate, Arava, Imuran, Cellcept, Myfortic, Cytoxan, Benlysta, Rituxan, or any of the biologics, then you should get pneumonia shots. First, I'll talk about the pneumovax. The pneumovax protects you against 23 strains of pneumococcal pneumonia. You should get 2 vaccinations 5 years apart, and then you should get a 3rd vaccination when you turn 60 years old. And this is easily gotten at most rheumatologists and most primary care physician offices. But the second one is called Prevnar, PCV13. This is a brand new recommendation. This shot has actually been available for a long time. Usually it's given in children. However, the Centers for Disease Control recently came out and said that everyone who takes an immunosuppressant medication, especially the ones I mentioned on the previous slide, should also get this particular vaccine. A few good things about this vaccine is, number one, it's a lifelong vaccination, so once you get it once, you never need to get it again. Number two, it protects you against 13 strains of pneumococcal pneumonia. The reason it's so important to prevent pneumonia, by the way, is when we look at people who die from infections who are on immunosuppressant medicines, pneumonia is the #1 cause of death, and pneumococcal pneumonia is the most common cause of pneumonia in that group. The timing of Prevnar does have to be is kind of complicated, so it's really important to understand this. If you've already had the pneumovax, you have to wait at least a year before you get the Prevnar. If you have not had the pneumovax, we recommend getting the Prevnar first and then getting your pneumovax 8 weeks or later after the Prevnar. By the way, most doctors don't give the Prevnar in their office. About the only doctors who do are either family practice doctors who see a lot of children or pediatricians. So if you have a family practice doctor, they probably give it in their office, and you can ask your family practice doctor for it. If not, if you see an internal medicine doctor or a rheumatologist, all they have to do is write you a prescription, take it to your local pharmacy, and the pharmacist will give it to you in the pharmacy. By the way, I don't recommend going to pharmacies like CVS, Walgreens, or Rite Aid. Most of the time they don't have it available, and I've actually had some of my patients actually get the wrong vaccination. They gave them the pneumovax by accident. Instead, go to a pharmacy where they have a grocery store. Like in our area, it's Giant Pharmacy and Safeway Pharmacy. They seem to do a lot better with giving the Prevnar because this has to be refrigerated, and it seems like they have a lot more refrigeration capacities in the grocery stores. So please get your Prevnar. The next secret only applies to those who are 26 years old or less, so the rest of you can ignore this. But if you're 26 years old or less, you need to get vaccinated against a sexually transmitted disease called human papillomavirus. We now know that systemic lupus patients have higher rates of infection from human papillomavirus, also called HPV, compared to people who don't have lupus. We really don't know why this is, but when we look at newly diagnosed lupus patients, there's higher rates of this particular infection. This is a sexually transmitted virus. Most people, in fact up to 80% of the population, will be infected during their lifetime with this. In addition, the bad thing about this virus is that it can cause cancer. Anal cancer is the #1 cause of cervical cancer in the world, but also vaginal, penile, throat cancer, especially in non-smokers, and even some non-melanoma skin cancers. In fact, these particular cancers occur more often in lupus patients than in those who don't, and it probably has to do with the abnormalities of the immune system not being able to control the human papillomavirus well enough. So it's really important to vaccinate yourself to prevent from getting this in the first place. This is one of the very few types of cancers that you can actually prevent from getting in the first place by simply being vaccinated. If you get the Gardasil vaccination series, which is a series of 3 vaccines, it helps to decrease the risk of getting the 3 most common strains of HPV that are more likely to cause these cancers. The Centers for Disease Control recommends that everyone, male and female, get this series as young as they can between the ages of 9 years old and 26 years old. Secret number 14, cancer screenings are very important as well. Unfortunately, studies show that a large percentage of lupus patients do not keep up on their cancer screenings. most likely the reason for that is that we really demand a lot of our patients. We're sending you to a lot of different doctors. We're asking you to do a lot of blood tests, a lot of urine tests, a lot of x-rays, and it does get very expensive over time to do all of this, in addition to the time commitment it takes to get everything done. And I think because of this, our patients are less likely to get their screening tests for cancer, like colonoscopies, mammograms, pap smears. But it's really important that you do keep up on top of this, because cancer is the 4th most common cause of death in lupus patients. A new recommendation, by the way, is in those who have had a history of heavy smoking or currently smoke. It's recommended that you get a low-dose chest CAT scan once a year to detect lung cancer, because we can actually catch it at curable stages if you get a yearly chest CAT scan. Secret number 15. Most lupus patients should be taking vitamin D regularly and for the rest of their lives. The vitamin D story is very interesting with lupus. For the past decade or so, we have noticed that our lupus patients have higher rates of vitamin D deficiency than the normal population. When we look at patients who are newly diagnosed, vitamin D deficiency is very common. In fact, it's associated with more severe disease. When we look at those with mild disease, their vitamin D deficiency is not as bad as those who have severe disease. So there's definitely a severity association with that. And then additional studies actually showed that patients who would flare up with their lupus would actually have low vitamin D levels as a sign of their flares. Many people listening to this, you realize that your doctor gets complement and double-stranded DNA levels to look for possible flares. During a flare of lupus, we expect to see the complement levels low in some people, or the anti-double-stranded DNA level to be high in some people during their flares. There was a study that actually showed that low vitamin D levels correlated with lupus flares just as accurately as high double-stranded DNA and low complement levels. We now know that vitamin D is essential for a proper working immune system. The white blood cells of the immune system actually contain receptors for vitamin D. The best study up to date proved that our lupus patients should be taking vitamin D, and that was done at Johns Hopkins by Dr. Michelle Petrie. She did a very interesting study. She took over 1,000 of her lupus patients. She identified those who had a vitamin D level less than 40, and she put every single one of those patients on the prescription strength vitamin D called ergocalciferol. She put them on 50,000 international units once a week. In addition, she had them take a calcium with vitamin D added to it, just the over-the-counter type, 1 tablet twice a day. Then she followed them for 2.5 years and followed their disease activity. At the end of 2.5 years, she looked at those whose vitamin D levels improved and those who did not improve. In those whose vitamin D levels went up by 20 points or higher, she found that they had decreased lupus disease activity simply by raising their vitamin D level. Even more striking is that there was a decrease in the amount of protein in the urine in those who had inflammation of their kidneys, or what we call lupus nephritis. This is incredibly interesting because it's really hard to prove that many lupus medicines actually help with lupus nephritis. And here we have a simple vitamin D supplement that can actually do that. So the bottom line is that every single systemic lupus patient should get their vitamin D level checked, find out what yours is. Every visit with your doctor, ask what your last vitamin D level was. Your goal is to get it to 40 or higher. If yours is lower than 40, you should ask your doctor to be put on a vitamin D supplement. Then about 3 months later, get it rechecked. And if it's still less than 40, go on a higher dose. A lot of patients will tell me, well, I can't get my vitamin D level up. And actually, that's incorrect. Every single patient can get their vitamin D level up. It's very easy. You just keep coming up with it, going up on the dose. In fact, I have some lupus patients who actually take the prescription strength 50,000 international units once a day instead of once a week in order to get theirs up high enough. Secret number 16. If you take steroids such as prednisone or methylprednisolone, ask your doctor if you should be on a medicine to prevent osteoporosis. Studies show that 50% of lupus patients actually have vertebral fractures in their spine due to osteoporosis, and most of them don't even know that they're there. We can actually now prevent osteoporosis and broken bones from happening in the first place. Because of all the medicines that we end up having to use to treat lupus, this is something that oftentimes falls through the cracks. So if you're not on a medicine to prevent osteoporosis, ask your rheumatologist if you should be on one. If you've been on steroids for a long time, or if you've been on high doses of steroids, you may have something called adrenal insufficiency. The adrenal gland is a small gland that sits on top of the kidney, and it makes prednisone every single day. In fact, all of our bodies normally make 5 to 7 milligrams of prednisone a day. It's essential for how the body functions. However, when you've been on prednisone for any length of time, the adrenal gland sees all that extra steroid in the body, and it actually starts to shrink, and it stops making steroids. The dangerous part of this is that we actually need more steroids during periods of stress and infections and surgeries. For example, if I were to get the flu, or if I were to get a strep throat, my own adrenal glands would start to make extra steroids as high as 20 milligrams a day just to get me through the stress of that infection. But when people with lupus who have been on steroids for any length of time, if they get an infection or they get surgery or they're in a traffic accident, when they should be getting more steroids from the adrenal gland, they can't do that, and they can actually get sicker because of that. So it's important to get a medical alert bracelet that says that you're steroid dependent or that you have adrenal insufficiency. That way, if you do show up in the emergency room, the doctors will know to give you extra doses of steroids, which will actually make you better and make you feel a lot better quicker. Secret number 18, make sure to take your medications regularly. This seems like it would be common sense, but unfortunately we know from studies that half of our patients don't even take their Plaquenil regularly. Plaquenil, or what's called hydroxychloroquine, is actually the safest and one of the most important medicines to keep lupus under control. We know that our lupus patients who have flares or who do worse, when we look at what's going on with them, the number one cause of they're not doing well is noncompliance, and especially with not taking their medicines regularly. So if you find that you're missing doses of your Plaquenil or other medicines, it's really important to figure out how to get those doses of your medicines in regularly to help keep from having flares or getting worse. Secret number 19, keep your own medication list at home. Don't rely upon the doctors to keep it for you accurately. We are constantly seeing inaccuracies in the medicine list, and typically this is how it happens. I think my patients are taking certain medicines certain ways, and they come into the clinic, and then my medical assistant runs through their medicine list, and the patient quickly answers yes, 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 yes to all of the medicines. They don't even really think about what they're truly taking. Then I go into the room and I find all these inaccuracies. The better way to do it is to actually have your own medication list on your computer at home, or keep a handwritten list, such as on this example that I have on the slide. And then every time a medicine is changed, a dosage, or how often you take it, change it on your list immediately. And then when you go into any doctor's office, instead of answering questions yes or no for your medicines from the nurse or the medical assistant, instead hand them a copy of your updated list, and that way you can know they can know 100% exactly what medicines you're taking. Another alternative is to always carry your bag of medicines into each doctor's visit. But I recommend the list because if you ever end up at the emergency room, it's really important that you be able to just take it out of your wallet or purse and give it to the emergency room personnel. Secret number 20, all patients should be on an anti-malarial medicine such as Plaquenil, chloroquine, or quinacrine. The benefits of anti-malarial medicines are numerous. Number one, they increase lifespan. There was a very nice study from Canada probably about 15 years ago now that actually showed that over 1,000 patients, they were followed for 15 years for their lupus. And those who took their Plaquenil regularly, 90% of them were still living at the end of 15 years. And those who were not taking Plaquenil regularly, only 65% were still living. So Plaquenil and antimalarials do increase your lifespan and decrease mortality rates with lupus. They also decrease internal organ involvement. They decrease the risk of your lupus worsening. They decrease the need of steroids, or they can help lower your doses of steroids, and everybody hates taking steroids with their lupus. It also helps stronger medicines work better. People who take strong chemotherapy even should absolutely take Plaquenil also, even though it's a very weak lupus medicine. There was a very nice study from Johns Hopkins a couple of years ago where they took patients with lupus nephritis, or inflammation of the kidneys, where the lupus was attacking and destroying their kidneys. They put all the patients on Cellcept, which is also called mycophenolate. Half the patients did not take Plaquenil, but the other half took Plaquenil along with their Cellcept. At the end of a year, twice as many patients who took Plaquenil with their Cellcept were in remission compared to those who did not take Plaquenil. So it's really important to take that Plaquenil even if you're on a stronger medicine like Cellcept, methotrexate, or Cytoxan. Plaquenil and antimalarials also decrease blood clots. They decrease a complication called neonatal lupus, where the baby can be born with lupus, and it greatly increases the chances of having a successful pregnancy. A very interesting side effect of Plaquenil, by the way, is that less patients will actually develop diabetes who have lupus compared to those who don't take Plaquenil. Dr. Michelle Petrie, one of the world's lupus experts, actually stated in a textbook for other doctors, hydroxychloroquine, which is Plaquenil, should be put in the water supply of people who have lupus. And that's because Plaquenil is so safe and so effective in so many patients. Next, we'll talk about protecting your eyes against eye problems from Plaquenil. Unfortunately, back in the old days, especially when we used higher doses of Plaquenil, sometimes it would deposit in the back of the eye and could cause irreversible eye problems and even significant blindness in the eyes. And so I'm going to give you some tools that you can use to prevent this complication. And with this advice, it's rare to get an eye problem from Plaquenil. Number one, download the Amsler grid from the internet and just print it out on a piece of paper and put it above your desk. About once a month, use it. And the way you use this is cover up one eye with your hand, and then with the other eye, look at the dot in the middle. And you should be able to see all the lines, and they should be fairly straight, and they should not be blurry or wiggly. And then you do the same with the opposite eye, with the hand covered over the other eye. If you notice any abnormalities, by the way, it doesn't necessarily mean that Plaquenil is the cause. In fact, Plaquenil will rarely be the cause. Usually it's due to something else, things such as glaucoma, cataracts, or macular degeneration, which is an aging problem with the eyes, or even diabetes or high blood pressure problems with the eyes can cause these problems too. But it's a great screening test to at least be able to do, and if you're not able to see all those lines, make sure you see your ophthalmologist right away. Another very important thing is that most people with lupus should not be taking 400 milligrams a day of Plaquenil. I bet that most of you listening to this are probably taking 400 milligrams a day of Plaquenil, or two of the 200 milligram tablets. However, recently the American Academy of Ophthalmology has made dosing recommended changes for Plaquenil. The reason for this is that Plaquenil does not deposit in the fat of the body. It only deposits in the lean tissues of the body. And because of the way that women are made and they have a higher fat percentage than men, especially women should be taking lower doses. The incidence of eye problems from Plaquenil is greatly increased if someone takes more than 6.5 milligrams per kilogram of ideal body weight of Plaquenil per day. We can figure out ideal body weight by looking at the height. If you're 5'6.5" or less, or in other words, if you're less than 5'7", you should be on 300 milligrams a day or less of Plaquenil. And then if you're less than 5.5 inches or less than 5'1/2" inches, you should be on 200 milligrams a day or less. If you're thin, then you want to go by your actual body weight. And the number to remember is 135 pounds. If you're 135 pounds or less and you're a skinny person, then you should be on 300 milligrams a day or less. By the way, these are brand new recommendations. Most rheumatologists don't even realize they're there. If you do get, if you belong to the Lupus Foundation and you get the magazine called Lupus Now, there's a really nice article in this most recent edition where it actually goes through this extensively in the article. If you don't get Lupus Now, just go to the Lupus Foundation website and you can order Lupus Now and see the article, and you can show it to your rheumatologist. So in addition to being dosed properly, you should also use the Amsler grid monthly. After 5 years of being on Plaquenil, you should see your ophthalmologist at least yearly, and then you should get specific testing done. Previously, less sensitive tests were done on the eyes, such as certain visual field tests that really don't catch Plaquenil toxicity early enough. Now it's actually recommended that all lupus patients get a specific visual field test called the 10-2 test yearly. In addition, they should get one of the following 3 tests: SDOCT, FAF, or multifocal ERG. And I really think it's important that rheumatologists and doctors specifically ask for these tests, because if they don't, a lot of eye doctors don't realize that they should be done. In fact, it's a good idea that you show this information to your ophthalmologist and ask them that they specifically do this particular type of visual field test and one of these 3 tests that I listed there on your eyes yearly as the best test to make sure that you don't have any Plaquenil problems after being on it for 5 years or longer. Most people with systemic lupus realize that they should not be exposed to the sun because the sun can hurt them in some way. And it's really important that you understand why that happens and how it happens, so it can help motivate you to do this even better. Only 30% of lupus patients actually get a rash from the sun, but all lupus patients' disease will actually be made worse by the sun. And it's not just the sun, it's any source of ultraviolet light. So ultraviolet light is a particular spectrum of the light coming from the sun that contacts the skin, and then the cells that are right underneath the skin, the ultraviolet light actually causes damage to those cells. In fact, that's why we get wrinkly as we get older. That's why we get the age spots on our hands, is because of the constant damage that our cells are undergoing. So these cells underneath the skin, they basically explode and they release their inner contents into the bloodstream of the body. And remember those anti-nuclear antibodies, or that ANA that you were positive for, that major diagnosis of lupus in the first place? Anti-nuclear antibody are named because these particular antibodies of the immune system, or the lupus immune system, they identify these proteins that are being released from the nucleus of these cells. And then these antibodies actually cause the lupus immune system to become active, not just at the skin, but throughout the entire body, to include the heart, the lungs, and in the kidneys. For example, double-stranded DNA antibodies, when they see the DNA released from the skin cells, they can go to the kidneys and actually deposit in the kidneys and cause lupus nephritis. It's important to understand how we think about dosing of ultraviolet light. Of course, the sun is the most important source of ultraviolet light. It's the strongest source that we naturally have. And I think it's very easy for most lupus patients to realize that if they're in the sun on the beach for a long time, that they can get a sunburn, and they certainly can get a flare-up of their lupus. If you're out in the sun for 15 minutes, you're much more likely to get sick with your lupus compared to if you're only out there for a minute or 2. The dose of the ultraviolet light that contacts your skin is basically the strength, which is very strong from the sun, times the amount of time that you're out in it. However, it's important to realize that indoor lighting also gives off ultraviolet light. It's a much smaller amount of ultraviolet light at a time, but when you look at that small amount times a much longer length of time, which is all day long basically, except when you're asleep or in bed, then it's a lot of ultraviolet light over time. And so this is important to remember, because everyone with systemic lupus should be using sunscreen religiously on all sun-exposed areas every single day, even if you don't go outside. If you notice, I have the newer compact fluorescent light pictured on the left side, you know, those ugly lights with the coils. The reason I put that on there is because they're higher in ultraviolet light emission than the older incandescent light bulbs that these now replace. So these are even worse for lupus. It's important to use some type of ultraviolet filter around these lights if you're going to use them in your home. But even better, I recommend getting the newer LED lights. These are better for the environment. They use a lot less electricity, and these are the ones that last for 20 to 30 years when you use them. So even though they're a little bit more expensive than the regular light bulbs, they can last a long time, and they're much safer for your systemic lupus. You can actually get LED lights that have no ultraviolet light in them at all. And if you go to places like Amazon.com, you can actually find them pretty cheaply. So learning to avoid the ultraviolet light is very important. In the handout that we're going to provide you, I have a long list of important instructions on how to decrease ultraviolet light exposure. Very important to use that sunscreen religiously every day, even if you don't go outside. Make sure to put it on 2 to 3 times a day if you do go outside, and then abide by the other ultraviolet protection measures in the handout. Another important thing, by the way, is to increase the SPF of your clothing. Most clothing only has an SPF protection from ultraviolet light of only about 5, but if you use something called RIT Sun Guard, R-I-T and then Sun Guard, and then it's a powder that you can apply to your clothing when you're washing it, actually increases the SPF to 30 or higher. And just all you have to do is use it a few times a year. You can buy it at most large stores or over the internet from places such as Amazon.com. And that will be in the handout we'll give you. I'm a reality show buff. I love to just veg out in front of reality TV when I'm trying to get away from a hard day at work. And one show I like is The X Factor. A few years ago, Joshua Krachik, he was one of the runners-up for The X Factor. The reason I'm showing this picture of him with his mom is that he came and he sang at our 2012 Lupus Foundation Butterfly Gala. And the reason he was there is that his mother has systemic lupus erythematosus. Her name is Lisa Pym. I found a very interesting comment that he said is that the only thing that lupus has done good for his mom is that it's kept her young looking because she's not allowed to smoke cigarettes and she has to use sunscreen every day. And that is another good thing about sunscreen, is that sunscreen and not smoking are 2 of the most important things to keep your skin actually looking younger. And I think you can agree that she looks very young. She looks more like his sister than she does his mom right there. So if you can't convince yourself to wear that sunscreen religiously for your lupus, do it to look better as you get older. Secret number 23, don't eat alfalfa sprouts or mung bean sprouts. These actually contain an amino acid called L-cannabinine, which can actually increase lupus activity. There was a study, an environmental health study in Baltimore, Maryland, where they actually identified people who ate more alfalfa sprouts that they had a higher risk of developing systemic lupus than those who don't. There's also another study where they took macaque monkeys and they fed them a diet high in L-cannabinine, which is found in alfalfa sprouts, and they actually developed lupus nephritis and the antibodies that we see in systemic lupus. So even though we want you to eat a healthy diet, don't include alfalfa sprouts or mung bean sprouts. The next secret is to include a lot of omega-3 fatty acids in your diet. This is 3 examples of foods that are high in omega-3 fatty acids. On the top left, we see some delicious looking salmon. Also mackerel is another good example. The bottom left are walnuts. Walnuts are nuts that have the highest concentration of omega-3 fatty acids. And then the top right and the bottom are flax seeds. In fact, flax seeds have the highest concentration of omega-3 fatty acids of any other food. The reason it's important to include these is that omega-3 fatty acids in food sources have been shown to actually decrease inflammation, decrease cardiovascular disease. Remember, heart attacks and strokes are the #1 cause of death, and actually decrease lupus activity. There's been a few diet studies where patients who took omega-3 fatty acid diets actually had less disease activity compared to those who did not. In addition, omega-3 fatty acids can decrease the dryness from Sjogren's syndrome as well. It's really important to remember to only get this through foods like fish, walnuts, and flaxseed. Don't do it through pills. There's actually been omega-3 fatty acid supplement studies in lupus that showed absolutely no benefit for lupus, and there's been over 2,000 studies now for heart attacks and strokes that really show that the over-the-counter supplements like fish oil capsules, omega-3 fatty acid capsules, don't decrease heart attacks and strokes. In fact, just this last week in the Journal of the American Medical Association, another study came out showing that these capsules and supplements do not help out. And it was such an important article that there was an editorial written by 2 physicians where they said that no patient should be taking over-the-counter supplements of fish oil to decrease heart attacks and strokes because they just do not work. Also consider having olive oil and canola oil in your cooking on a regular basis. Olive oil decreases the amount of the bad omega-6 fatty acids in your diet. And there's actually been a study in lupus patients where they had lupus patients eat 1.5 tablespoons of olive oil every day, and they actually saw less lupus activity in those who did. So olive oil may have some anti-inflammatory properties in people who have lupus. Secret number 25, do not take echinacea. In fact, any over-the-counter supplement that says it boosts the immune system, you should never take. The reason for that is that lupus already has an overactive immune system. Your immune system is overactive, attacking your body, and the last thing you want to do is boost it even more. Echinacea is oftentimes promoted to decrease the symptoms of flus and the cold, but please don't take it if you have lupus. In the Johns Hopkins lupus cohort, they actually had several patients in their cohort develop severe flares of their lupus simply from taking echinacea. In fact, a couple of those patients had lupus nephritis flares and ended up on chemotherapy because of the echinacea. Secret number 26. DHEA, which is a hormone, may actually help decrease lupus activity. In fact, very good studies show that people with mild to moderate lupus can get improvement simply by taking DHEA. DHEA is a natural hormone that all of us have in our bodies, and studies show that many lupus patients make too little amount of DHEA. So they did a lot of studies looking at what happens if we give our patients extra DHEA, and these studies show that actually many of our patients will have improved disease activity if they take it. Other nice things about taking DHEA is that it can decrease the need for steroids, it improves bone density, and it also actually may decrease the risk of getting breast cancer. I do not recommend, by the way, getting over-the-counter DHEA. Studies show that 80% of over-the-counter DHEA supplements are very bad quality products. The reason for that is that the FDA does not regulate the quality of over-the-counter supplements. They only regulate the safety of them. If they cause any bad side effects, then they pull them off the shelf. But otherwise, you could be getting zero DHEA if you buy it over the counter or over the internet. Instead, wait for the FDA has actually approved DHEA in the treatment of systemic lupus, and it's in a brand name called Prastera. In fact, if you go to prastera.com, Prastera.com, you can read a lot about DHEA and how it benefits lupus. I talked to one of the pharmaceutical representatives from the company, and they said that about 6 to 8 weeks from now, it should be commercially available. You do have to have a prescription from your doctor to take it. It's 200 milligrams once a day in capsule form. Secret number 27. Please learn how to decrease stress in your life. Multiple studies show that increased stress can actually cause lupus flares. I'm probably preaching to the choir. Whenever I tell anyone with lupus this, it's no surprise to them because they oftentimes notice that their lupus gets worse during lupus flares. In fact, one study was very interesting, and they actually looked at people who had a genetic deficiency or a mutation in a particular gene that makes it more difficult for them to deal with stress. These particular patients, their bodies don't make enough serotonin or norepinephrine, which are very important for getting us through stress, and they found that patients who had this particular genetic mutation, they had more lupus flares and worse lupus flares during stress compared to those patients who did not. In fact, some of them even had flares of lupus nephritis or kidney inflammation. Learning to decrease stress is something that takes a lot of hard work. It's very important to learn how to say no, Too many of us do too many things in our lives that are not important, especially women who have systemic lupus. Women are oftentimes expected to be the caregivers in the family. They take care of the children. They take care of their husband, who oftentimes acts like a child. And so it's really important to prioritize things in your life and learn how to say no to the unimportant things and just concentrate on your family, getting healthy, exercising right, eating right, etc. You need to work on it getting 8 hours of sleep religiously every single night. That's also very important. So in the handout, I actually put a nice list of things you should do to decrease stress in your life, because it is something that you can learn to do. Secret number 28, and this is the last secret. It's very important to learn as much as you can. And then those of you who are listening to the talk, you've already demonstrated that you're interested in learning more about getting your lupus under control. So you're actually way ahead of the game. When I look at my patients and those who do well and those who do not do well, I notice that those who really learn as much as they can, they do better in the long run because they really do take their medicines, they do take their vitamin D, they do exercise regularly, they eat properly, and they definitely do much better. So ways that you can learn to tackle your lupus better is joining Molly's Fund. They actually have a very good blog that has great articles about lupus on a regular basis. There's also a free journal article, or a free journal, a medical journal on the internet you can join for free. Up to now, almost all lupus research has been published in articles in journals that only doctors get. For example, when I get arthritis and rheumatism, or the journal called Lupus, I have to pay a couple of $100s a year just to get one journal, and then I have to have a whole bunch of these to try to get as many of the articles as I can to keep up on everything, and it's incredibly expensive. A nice thing is that the Lupus Foundation of America joined together with the British Medical Journal, and they actually published this new journal on the internet called Lupus Science and Medicine. And every single person can get this free of charge. You don't have to pay 1 cent. Just go to this particular website, and when you go to the website, click on email alerts. And every time a new article is published about lupus, you'll actually be sent an email alert, and you can click on it and you can read the journal article yourself. You don't have to wait for a doctor to interpret it for you or learn about it through another means. Another good way is to like me at my Facebook page. I have a Facebook page, and if you go to Facebook and type in Lupus Encyclopedia, I put facts and tips about lupus on there almost on a daily basis. And a lot of my patients find that very helpful as well. Or you can follow me at Twitter at Lupus Encyclopedia. And every time I put on a new fact or tip on my Facebook page, you'll get a Twitter or a tweet about me doing that. The butterfly is the main symbol that we use for systemic lupus, and anyone with lupus realizes that we use the butterfly a lot. So what does the butterfly mean? I like to go back to the story of Pandora. Pandora from Greek mythology, she was the first woman who was created by the gods. And Pandora had a lot of attributes, and one of them was the attribute of curiosity. The gods gave her a box, and they told Pandora, don't open this box. Well, of course, Pandora was very curious, and she opened up the box. To her horror, she released all the evils and pestilence and diseases into the world. And it was very troubling, and she got very sad and upset because she did this. After all the evils had left the box, she looked down into the box, and one thing remained in the box. There was one item still there. And that item was actually a beautiful butterfly. And the name of the butterfly was hope. This hope stayed with Pandora. Every 2 years, lupus experts from around the world, we all get together at something called the Lupus International Congress, and we hold it in a different part of the world every 2 years. These lupus experts recommend that whenever you see the lupus symbol of the butterfly, don't think of the butterfly rash on the face, because that's something bad that goes on with lupus. Instead, think about the Pandora's box butterfly, the butterfly called hope, because every lupus patient is like a caterpillar that can turn into a beautiful butterfly. Just like the caterpillar had hope of someday becoming a beautiful butterfly, even though lupus is causing something horrible to happen in your life and making you feel helpless, you can have the power to control lupus itself. You can take these secrets home with you, and practice them in your own lives so that you can have hope of controlling lupus instead of lupus controlling you. This does remind me of the story of Nick Cannon. Nick Cannon is a celebrity who hosts America's Got Talent. He's also a rapper, and he's married to Mariah Carey. In 2012, Nick Cannon actually developed severe lupus nephritis. He was hospitalized during a vacation when he was in Colorado. He had incredibly swollen legs. He was very sick. He was in the hospital. He even developed blood clots. He was put on chemotherapy, high doses of steroids, and was also given blood thinners. Nick Cannon came and he hosted, as the Grand Marshal, our DC Lupus Walk to End Lupus just a few weeks ago, and he gave a really an incredible speech. He yelled out to all of his fellow Luppies. He called himself a Luppie, and he said a couple of things which I found astonishing. Number one, he said, even though he has this positive test for lupus, he's going to turn this test into a testimony. What Nick Cannon did is that he started to get his life under better control. He actually started to exercise more. He started to eat better. He worked on getting more sleep at night, working on decreasing stress in his life, and he videotaped his journey with lupus. In fact, if you go to the YouTube.com, you can actually watch his motivational series about exactly what he went through. You can actually see him in the hospital and sick and how he got through it. And he said now that because of lupus, he's actually healthier than he's ever been in his entire life because of him turning his life around. In addition, there's hope that our future treatments will be a lot better in the near future. Today's treatments for lupus are markedly better than what they were even a decade ago. With Benlysta becoming the first new drug for lupus in over 50 years a couple of years ago, we have a lot more drugs on the horizon now to treat lupus, and we're certainly hoping that a cure can be found in the future. So I challenge each and every one of you to take these secrets home with you, do them as much as you can, incorporate them into your life so that you can take control of lupus and not let lupus control you. And thank you very much, Tracy. That's the end of my talk, and I'll be glad to answer any questions.
Thank you so much, Dr. Thomas. We do have a couple questions coming in, so I will go ahead and read them to you. The first question is, how often are cancer screenings recommended, and does it go by age?
That's a great question, and it's a very complicated question. It would be like a 2-hour lecture just for that. All the cancer screenings are based upon different ages and gender and what's going on, so I really can't say in a simple answer what that is. But it is important to realize that if you're a woman, you need to get pelvic exams with a pap smear and mammogram regularly. And everybody over the age of 50 years old should get a colonoscopy. But for example, if you have a strong family history of these things, then you need to get them more often. So this is a question you do need to pose to your primary care physician, and you do need to make sure you keep up on those cancer screenings. If you smoke a lot or have had a heavy history of smoking, then definitely want to ask your doctor about that low radiation CAT scan of the lungs once a year. But that's a very important question, and one you should definitely bring up to your primary care doctor.
Great. The next question, and if anyone else has any questions, feel free to type them into the chat box that is on your screen. The next question, you mentioned that you get lupus through genes from your mother and father. Do you need it from both sides or just one?
That's also an excellent question. The bottom line is that there's over 30 different genes we now know of that actually cause systemic lupus. The more genes you get, the more likely you are to have the disease. And it doesn't really matter if you get them from your mom or dad, but that's a very common scenario, is getting some from the mom and some from the dad. But you can get, for example, 10 genes from your mom, and she might have a very strong family history of lupus, and also other autoimmune diseases, by the way. For example, rheumatoid arthritis, scleroderma, Sjogren's syndrome, thyroid disease. These are all actually caused by similar genes. And so if you have a mom who has a lot of these things going on in her family, you might inherit 10 genes from her and none from your dad. Or both sides of the family might have, and you might get 5 from each side. Or another common scenario is that no one on either side of the family has any autoimmune disease, then all at once someone can show up having lupus. And the reason for that is that you might have only gotten one from your mom, two from your dad, and there was just no one else in the family that had enough of those genes to cause the disease. These genes, by the way, are also the reason why every single lupus patient is different. It depends upon which genes you get that actually end up causing which manifestations. And it's just amazing when you look at all the different combinations of these 30 genes. You can have millions of different combinations of the genes, and that's why you can have one patient who might have blood clots and the butterfly rash. Another patient might have joint pains and dry mouth. Another patient might have recurrent pleurisy and Raynaud's phenomenon, and that's why all lupus patients are so different from each other. And I think that answers the question.
Great. And if anyone needs any follow-up, feel free to, type in again. The next question, what are the signs of lupus nephritis?
The most common symptom of lupus nephritis is zero symptoms whatsoever. And that's why we urge our patients to come in at least every 3 months for blood work and a urine sample. In fact, it's the urine sample that's the most important thing because we're looking for an increased amount of protein in the urine. Most patients with lupus nephritis don't have any symptoms at all until they actually have severe disease. And by that time, they almost certainly have to go on strong chemotherapy like IV Cytoxan or cyclophosphamide. And so the answer to the question is the person feels perfectly normal. They don't have any symptoms at all. As it gets worse, though, the symptoms that can occur are fatigue and tiredness, swelling of the ankles that gets worse during the latter part of the day. And the reason for this is that their kidneys get worse at excreting fluids, and so they start to retain fluid, and then it causes something called edema that can build up in the legs. So that's not an uncommon symptom. And by the way, most people do not get any pain. A lot of people think, oh, I must get back. You probably get back pain if you get lupus nephritis or kidney problems, but that's actually untrue. There's usually no pain involved with lupus nephritis.
Great, and we actually have a blog on lupus nephritis on mollysfund.org, which I think you helped contribute to.
Yes.
All right, so the next question, what about taking CoQ10? Is that something we should be taking?
Most supplements should not be taken by most people, period. Now I'll go back to the FDA or the DHEA thing. We've actually studied quite a few over-the-counter supplements for quality, and it's really horrible how the vitamin and supplement industry are doing as far as quality. Even if Q10 did work for something, I guarantee you that most Q10 supplements are poor quality supplements. CoQ10 supplements are poor quality supplements. DHEA, glucosamine, most recently vitamin D supplements even, we find that 75 to 80% of these over-the-counter supplements are poor quality supplements, even containing zero of the supplement that they have. The bottom line with CoQ10 is that there are absolutely no studies to show any efficacy in lupus whatsoever. It's oftentimes promoted for muscle problems. However, there's no proof whatsoever that it helps with lupus. Personally, I would not waste my money.
All right, and will your new book, the Lupus Encyclopedia, have a section on discoid lupus?
Yes, it does. I think that one of the strengths of my book is that it's very comprehensive. I touch on almost every important aspect of lupus, to include discoid lupus as well. I go over the treatments for discoid lupus, how to improve it, and then I go into a lot more detail about how the medications work and what the potential side effects are and how to prevent them from happening.
Okay. And is the recommendation that every lupus patient wear a steroid-dependent bracelet at all times, or do you have to be taking a certain steroid dosage or high dosage?
There are certain people who are at higher risk of having adrenal insufficiency than other people, and I actually have a nice list of this inside my book. It actually goes over every single one of them explicitly. just a real simple one, is if you've been on prednisone and have gained significant weight from it, and I think most of you can probably identify with that, automatically you are guaranteed to have some adrenal insufficiency. So if you've had that and you've been on prednisone long enough, you should be wearing the alert bracelet. If you've been on significant amounts for over 3 weeks, then you probably do have some degree of adrenal insufficiency as well. And so those are two of the most important ones. So more than 3 weeks at a significant dose of, I would say, around 10 milligrams or more, or anyone who's gained weight at all from prednisone should be considered as having some degree of adrenal insufficiency.
Okay, should people with lupus avoid getting tattoos?
Absolutely. And I'm glad someone brought this up. I see this all the time on the internet. I'm on Facebook a lot, and I love all the different lupus sites, by the way, because there's some great support groups on Facebook, such as Lupus and Me and so forth. But a lot of people are showing their tattoos of their butterflies for lupus, and it makes me cringe every time I see that. Number one, cutaneous lupus or skin lupus can actually be caused by tattooing. We actually have patients who actually end up getting chronic cutaneous lupus or discoid lupus right at the areas of their tattoo, and it can be very difficult to treat. Number two, any lupus patient who's on an immunosuppressant, it puts them at even higher risk of potential infection from these tattoos. Even though most tattoo artists are probably very good and use sterile equipment, there's still that risk of possibly getting blood-borne diseases such as hepatitis C, hepatitis B, and HIV infection. So I really do recommend no tattoos.
Okay, the next question. Will the Lupus Encyclopedia, when will the Lupus Encyclopedia be available? And I was just diagnosed at 50 years old. My mom was at 72 years old. Is it odd to be diagnosed this late in life?
So to answer the first question, my editor just told me that she's actually going to get her copies of the books on Monday, so I'm really excited because I should get my copy soon after that. On Amazon.com, it actually says that they expect to be sending their copies out around June the 5th. And so it's going to be very soon that the book will be actually hitting people's mailboxes. I'm really sorry to hear that you were just diagnosed with lupus. It has to be very difficult for you with seeing your mom having gone through it. But I will have to say that you're doing one of the best things you could possibly do with just now developing lupus. If you can do everything on my lupus secrets, your chances of having a good outcome are markedly better. As far as the age onset of lupus, people can develop lupus from 6 weeks old all the way up to 100 years old. So you can be any age and develop lupus. However, when we look at people who are most likely to get it, it's women of childbearing age. So women who are in their mid-teens to mid-40s are by far the most common group of people that we see first get their systemic lupus. And then it decreases after the childbearing years. And so it certainly has to do with the hormones that are going on inside the body. But we see people at all ages who can get systemic lupus.
Okay. So the next question, are body rashes common in SLE? Could Plaquenil make these worse or better?
Skin involvement from lupus is actually one of the most common things that we see. About 90% of systemic lupus patients will get joint pains and arthritis, but the second most common thing that we see is skin involvement from lupus, and there's a lot of different rashes that can occur from systemic lupus, and I do go through all of those in detail. I have a full chapter about that in the book. So lupus can cause a lot of different types of skin involvement. We call it cutaneous lupus, where cutaneous refers to the skin. However, skin problems with lupus is incredibly complex because, number one, our lupus patients get all the other skin problems that everybody else gets. So they can get eczema, psoriasis, things that are not even related to lupus. And then people with lupus can also get rashes because of medications. For example, some people can actually get an allergic reaction to Plaquenil and get a rash because of the Plaquenil, in which case we have to go down on the dosage of the Plaquenil. However, Plaquenil is the #1 drug of choice for cutaneous lupus because most patients with cutaneous involvement of their skin actually have a very good response to Plaquenil. If someone doesn't respond to Plaquenil by itself, by the way, we usually add another anti-malarial medicine, especially one called quinacrine, to the Plaquenil, and that usually does a really good job for a lot of patients. So we do use Plaquenil to treat cutaneous lupus, but it can also cause rashes itself.
Okay. I have a diagnosis of SLE. My son is being diagnosed with Ehlers-Danlos. Sorry if I didn't pronounce that correct. And it looks like I might have it too. I read that you cannot have both. Is that right?
That's incorrect, because lupus patients can develop every single thing that other people can develop as well. And this is actually an interesting question because Ehlers-Danlos syndrome, confusingly, is also called a connective tissue disease, because it's in Ehlers-Danlos syndrome, by the way, is a problem with collagen, where people they have a genetic predisposition to their bodies making abnormal collagen that doesn't connect the tissues together very well. The most common thing that we see is something called hypermobility or double jointedness, and in fact probably about 5% of women actually probably have a mild form of Ehlers-Danlos disease where they're double jointed because of it. So no, Ehlers-Danlos syndrome, especially the mild form, probably does happen in around 5% of people who have systemic lupus, and you absolutely can have both. The reason I bring up the connective tissue disease thing is that systemic lupus is also called a connective tissue disease, but it's an incredibly different type of connective tissue disease than Ehlers-Danlos syndrome, and that's probably why connective tissue disease is probably not a real good term for either one of these.
All right. And I can answer this next question. Someone asked if there will be a handout to go along with the webinar, and I will be sending out a handout following this discussion that goes over all of the secrets you discussed. So the next question, if you have multiple autoimmune disorders, does that increase your risk of complications?
Well, that's a good question. To be honest with you, I don't know. I would say probably not necessarily, and the reason for this is that people can have very mild systemic autoimmune diseases. For example, someone could have mild Sjogren's syndrome, an underactive thyroid called Hashimoto's thyroiditis that can be easily treated with thyroid supplements, and a mild case of rheumatoid arthritis, for example. And all of these could be very mild in the person, yet someone could only have one connective tissue disease or systemic lupus, and that person could have severe lupus nephritis, brain involvement, be on chemotherapy, and high doses of steroids. So I suspect that the answer is probably not necessarily.
Okay. Is there one type of lupus rash, and can it appear anywhere on the body?
There's actually 3 major categories of lupus rash, and when we look at the numbers of different rashes in each of those, it's an incredibly high number, and I do go through all of those in the chapter in the book on cutaneous lupus. The 3 major categories is the first one is called acute cutaneous lupus. Acute means something that comes on right away. The acute cutaneous rashes are the butterfly rash, or the red rash on the cheeks and the nose, but also the sun-sensitive rash when people with lupus go out into the sun, and if they get a rash on their arms and their face, those are both types of acute cutaneous lupus. The next type of lupus rash is called subacute cutaneous lupus, and this can look like little areas of psoriasis or raised red areas that can occur all over the body, especially on the chest and the upper back. These are very sun sensitive, and these are rashes that can come on slowly and can take a long time to go away, and we call that subacute cutaneous lupus. And then the third major category is called chronic cutaneous lupus. Chronic means that it lasts for a long time. Many of these rashes can be disfiguring and cause scarring of the skin. For example, discoid lupus is by far the most common type of chronic cutaneous lupus. If any of you know the singer named Seal, and if you notice he has a lot of pock marks on his face, and that's because of discoid type of chronic cutaneous lupus. So there are a lot of different lupus types of rashes.
Great. I have food allergies and bee allergy and keep an EpiPen just in case. Is using an EpiPen okay to use with lupus?
Absolutely, yes, and please keep carrying it and use it if you need to. It's not going to hurt your lupus at all. In fact, EpiPens is basically epinephrine. All of us have epinephrine in our bodies all day long, and it is not a known trigger of lupus. So that's a good question.
Okay. I have been seeing multiple specialists, endocrinologists for thyroiditis, Hashimoto's, neurologist for neuropathy, had numbness in the face and arms, and was told TIA. From an MRI and CT scan were normal, was borderline lupus. I see a hematologist and in borderline anemic, now a rheumatologist for joint pain. Was told this week that I have fibromyalgia and osteoporosis of the hands. I have lots of tingling and numbness in hands and feet and left leg. Positive ANA for over 1 year now. Severe fatigue, brain fog, concentration problems, lots of muscle pain, and had severe fatigue when in the sun, but no rash. Was told I don't have lupus. I now take low-dose aspirin, thyroid medicine, Neurotin, Zoloft, Flexeril, D3, vitamin B12. Could I possibly develop lupus at a later time?
The answer is unfortunately yes. The anti-nuclear antibody, or the ANA test, sometimes people call it the lupus test, but I really hate that term, and the reason for that is the following. Number one, it is a great screening test for lupus because when the test is done correctly using something called Hep2 substrate, using immunofluorescence, virtually 100% of our lupus patients are positive for ANA, so it helps us keep us from missing the diagnosis of lupus. But the downside of the ANA test is that it's very commonly caused by other problems. In fact, it's much less common to be caused by lupus than other things. For example, Hashimoto's thyroiditis alone can cause an anti-nuclear antibody test to be positive. So this ANA could be just related to the Hashimoto's. In addition, a lot of normal people are positive for ANA. In fact, 15 to 20% of all women are actually positive for ANA with it not being associated with them not having any disease associated with it. So it can actually be a normal finding in some people. However, now we also know that antibodies for lupus can occur many years before we know that they absolutely have lupus. A lot of the symptoms you were describing, the numbness, the tingling, the pain, the fatigue, the memory problems, all of those do sound classic for fibromyalgia, and so it sounds like probably your doctors have it right there. However, with your positive anti-nuclear antibody, it can be quite a frustrating thing for you and for your doctors, because it certainly could be related to your Hashimoto's thyroiditis, but it doesn't mean you won't develop lupus in the future. There was a study that came out a few years ago where the Army, I used to be in the Army and I was at Walter Reed for a long time, and we would actually collect blood from all of our patients all the time, and we stored them in freezers. And when we analyzed all this blood work, we found that antibodies for lupus appeared 5 years or longer before the onset of disease. And so these days, when we see a patient who has positive antibodies like ANA, we don't just recommend that they not come back anymore. We actually still want to follow them closely over time to see if they might develop lupus or something related to lupus. I wish we had better tests, because the ANA test is such a bad test as far as there being so many false positives, but it's one of the best that we have as far as not missing the diagnosis of lupus. The bottom line is that keep seeing your rheumatologist for treatment of your fibromyalgia and to make sure you don't develop lupus in the future, and I certainly hope you don't.
Okay, the next question is just a thank you for always answering questions, not just on here, but on Facebook and everywhere else as well. And you are great at always following up at all sorts of different outlets, so thank you. And then the next, do you know of any special types of gloves a person can purchase if they have Raynaud's phenomenon?
Yes, and by the way, the previous comment, thank you very much for that comment, because I really love educating patients, and Facebook is just amazing as far as being able to educate people, so thank you for that positive comment. As far as gloves and Raynaud's, this past winter, one of my patients who has really severe Raynaud's, she told me about these gloves that she got that made a world of difference. They're actually battery-powered gloves that keep her hands warm, and when nothing else would work in the past, no medicines and mittens or gloves or those sports hunters warmers that you can put in the microwave, none of those work very well, but these particular gloves that she bought off the internet that are battery powered made a world of difference. And we had a really cold winter, by the way, here in Washington, D.C. It was incredibly cold, and so it was a really good test for her. I wish I knew the name of them. I think she got them through Amazon.com. I think if you look up battery-powered gloves, you'd be able to find them, and I would just go by the ratings that other people put on them on Amazon.com. So there are battery-powered warming gloves available now.
And we are, a little bit over time. If you have time for a few more questions, we can keep going. But if anyone has any additional questions we don't get to, there is an email on the screen, so feel free to send those. But the next question, I've been on Plaquenil for 6 years. I'm getting purple and blue marks on my skin, especially my cheeks. Is there anything I can do about this? Should I change medications?
Unfortunately, there's nothing we can do except go down on the dose, and this is one of the bad, I'll call it a nuisance side effect. Plaquenil is so important for lupus because it really is a lifesaver in patients, keeping them from getting severe involvement and helping to get them into remission. But unfortunately, a significant proportion of our patients, it can deposit in the skin and cause these grayish and bluish and brownish colored patches, especially on the front parts of the legs. If you've been on Plaquenil a long time, you might notice some dark spots in front of your legs, on the neck, on the back and chest, and on the face, like this person says. So unfortunately, it is a common side effect. They can become less noticeable over time if the dosage is decreased, and so I personally do decrease the dosage if I see this developing in my patients, but unfortunately there's nothing that you can actually put on the skin to get rid of it. I wish that there were. It's a cosmetic concern, it's a nuisance side effect, but especially in a young person, who wants to look good and blend into society, I can see where it'd be just a horrible thing to have to put up with. I certainly hope that we get better treatments and a cure in the future, but Plaquenil is one of the best things that we have right now.
Okay, and I think this will be our last question. I recently had a flare, severe abdominal inflammation, which was originally diagnosed as a UTI, and I was given Bactrium. My renal specialist is suggesting putting me on Cellstep instead of prednisone as a preventative medication and as a steroid reducer. Is this a common treatment?
Absolutely. If I have someone who's on Plaquenil and they develop moderate to severe lupus, or if they're not being controlled with the Plaquenil by itself, I automatically put them on something else. If I've had to use steroids in that person at all, I add something else. Unfortunately, we don't know what that something else is as far as what's the best medicine. I wish we had a way to predict what's going to be the best medicine for any particular person. The different medicines we can use include methotrexate, Cellcept, mycophenolate, Arava, Imuran. All of those medicines can be very good. Cellcept is the most common one that I use for kidney involvement from lupus. So with you seeing a nephrologist, I suspect that you may be having some kidney involvement. So I would absolutely go with Cellcept in that particular case. Then if one of those medicines are not working, then I would go to Benlysta as my absolute third choice as far as a medication for lupus.
Great, and if anyone had any questions that didn't get answered, we will follow up with those, or you can email me at info@mollysfund.org, and I will connect with Dr. Thomas and we can get some answers to those. But I just wanted to thank Dr. Thomas for this great presentation and all the great work he is doing, and thank all of you for joining us, and please visit mollysfund.org if you have any other questions, and you can check out our blog and all of the other great things we have. So thank you, Dr. Thomas.
All right, thank you, Tracy, and good luck to everybody.
Thank you, everyone.
Good night.